So we're talking about quite a few different conditions here, but if you could give us an understanding of an overview of the treatments for different types of warts and skin tags and cysts, please.
So warts, when we talk about seborrheic warts or seborrheic keratoses, there are a number of simple treatments, one of them being cryotherapy, which is a treatment that can be performed on the same day as your consultation in clinic. And it's a one-off treatment with a gentle freezing spray known as liquid nitrogen that can be performed quite easily on that day. If these areas are a bit larger or more troublesome, then you might require treatment with curettage and cautery, which is a procedure that we do under local anesthetic. Again, it's something that can be performed very easily on the day, and essentially the wart is skimmed off the surface of the skin, and then a bit of cautery is applied. With viral warts, we can use cryotherapy. But we also have some topical treatments that we can advise and prescribe. When it comes to skin tags, again, you could consider cryotherapy, the freezing treatment, or a very simple treatment if you have got a number of them that are protruding from the skin, is what we call snip excision. And that essentially means a bit of something to numb the skin, and then snipping them off the surface of the skin, and perhaps applying a bit of cautery or allowing them to heal naturally. And those are very well tolerated treatments and very easy to perform. The last one being cysts. Cysts do actually have to be removed in their entirety, because what causes the cyst is the lining of the cyst, and therefore, unfortunately, treatments like incision and drainage, which some people will have already had without success by the time they come to see me, these don't work, and they can result in a more problematic removal in future. But in general terms, it's fairly straightforward to numb the skin, make a small ellipse on top of the cyst, scoop it all out, and then close with a few little stitches. And that can be very straightforward, often performed on the day, and results in the end of treatment.
If you notice that you have any of the symptoms or the conditions that we've just discussed, we invite you to book a consultation with Miss Penelope Pratsou, where she'll be able to assess your condition and give you a treatment plan.